My name is Abby Malone, and this is Invest Insights, where we interview thought leaders who are shaping our communities today. In today's episode, I speak with Dr. Dipen Parekh, the Chief Operating Officer for the University of Miami Health System. Dr. Parekh, many people are deterred from going to the hospital right now, especially those that are either elderly or maybe have pre-existing conditions. What do you believe will be the long-term effects of this, and how is UHealth instilling confidence in patients to return back to the hospital for their normal health visits?
So that's a great question. We already put all these measures in place about 3 months back. So we have a full policy where, first of all, for the patients, if they are really immunocompromised, they have other conditions and so on and so forth, televisit or telemedicine is a great way of getting almost 80 to 90% of your care. And the remaining 10 or 15% of the care that requires for you to go to a facility, either in an acute care hospital or in an outpatient facility, I'll explain in a second why that is very safe within our health system, the University of Miami Health System. So that's number one. Uh, the virtual care then ties into the confidence that they should have. So right from the time, so let's say if you are having a heart attack, or if you are having chest pain, or if you're having an abdominal pain, or if you have a stroke, when you come to our emergency room in the University of Miami Health System, you are in a completely separate area than the COVID patients. So anyone who has a COVID or COVID-like symptoms, they go to a tent that is placed outside our emergency room that acts like a parallel emergency room, totally separate from our main emergency room that we use for the non-COVID patients. So there's no intermingling of these two classes of patients, if you will. And then all our COVID patients have a totally dedicated separate transport from the emergency room. There's a separate route that patients take. There's a separate elevator. They all go into the topmost floor of our hospital, where we created the principle of vertical isolation. That means we have created 2 or 3 floors, one about the other, with negative pressure and vertical isolation, and all the measures in place where all the COVID patients are clustered in that area, and there's absolutely uh, uh, there's no contact between these patients and the other non-COVID patients. So if you're a non-COVID patient requiring a spine surgery or a cancer surgery or a heart surgery or a hip surgery, you're not going to interact with anyone with the COVID related issue out there. So completely different teams of nurses and doctors, different locations, different emergency rooms. Also, if you're going to have a procedure, every single person, we do more than 600 procedures a week within our health system. All these patients have a COVID test 24 to 48 hours before they get their test done to make sure that they're COVID negative. And only then we take them in. And for those patients who are actually COVID positive and they need procedures, we have totally different operating rooms and procedure rooms where we do this. We also have a no visitors policy, so we really limit our visitors to decrease the density of people within our outpatient and our inpatient facilities. So you'll be very safe from that perspective. And you can have your near and dear ones. They could be in designated areas where we keep them. Like we have a parking lot facility, we have other facilities where we use technology in terms of connecting our patients to their near and dear ones multiple times in a day during the daytime to make sure that they don't miss the near and dear ones. So that's going on as well as we speak. So if you look at our volumes post-COVID, our cancer volumes are actually already more than what it was before the COVID. And the other volumes are also coming up very rapidly because patients are now realizing that if they have any healthcare issues, University of Miami Health System, they have confidence that they're going to provide the most safe care to them.
You mentioned telehealth and telemedicine, and I really wanted to get into a discussion about that. Obviously, it's been at the foreground of a lot of discussions as of late, and the pandemic has truly propelled the expansion of telehealth and its possibilities to the foreground. You had mentioned to me prior that you were seeing 150, 200, correct me if I'm wrong, telehealth visits a month, and now you're processing 2,000 a day.
Right.
What was that transition like? How did you have to get the platform ready? Was it ready? How are you adapting your doctors to facilitate all these new visits in a new way?
Just kudos to the entire team. I have a wonderful team in our ambulatory operations. Steve Demers is the one who led our efforts along with many others. Unfortunately, I don't have the time to give you all the names, but truly a team effort because right from the time of deciding to do something like that, then getting about 1,500 physicians credentialed, you require a different type of credentialing to practice telemedicine. To get them credentialed in a timely fashion, to get the integration of the platform, we use the Zoom platform, Zoom and Epic platform to integrate that whole thing inside our electronic health record system. All these things were done in a record time by the team. And then we also have our patient access folks who basically help on the other side. Because there are a lot of patients in South Florida, as you know, Abby, that are old, elderly, they have cognitive issues, they have technology issues, they may or may not be savvy in terms of using the technology platforms. So we have dedicated personnel who basically take them through all these issues and prepare them before the actual doctor or nurse even comes in front of them for the visit. So even that we've been able to do thanks to the wonderful work from our team.
Were there other groups aside from the elderly that you had to make special considerations for?
Yeah, so just a group that comes into mind is we have this whole new area of televigilance. So we are using a very cool device called the TytoCare Health device for televigilance, where we are, whether it is using it for our students in the academic campus, you're using it for student athletes, using it for immunocompromised patients who don't want to leave their homes, cancer patients who we discharge from the hospital who don't want to travel, these telemedicine device or televigilance devices not only allow us to talk to each other the way we are doing, but this technology is such, Abby, that we can actually listen to their heart and lungs, look into their eyes and their mouth, and examine them through these platforms and deliver care. So we already have more than 2,000 of these devices in play, and we are one of the earliest adopters of this technology and made an investment to make sure that we do whatever we can or whatever we have available to us in the world to make it happen for this community and our patients.
Are there any other opportunities or innovations that you see continuing to be developed that will be present in the future or will be a part of the healthcare system as we know it for a long time to come?
Absolutely. I mean, if you the telemedicine is one, and there'll be virtual, there'll be a whole options or range of options for practicing virtual care. It could be specialty based, it could be primary care based. So that is definitely coming. I think we're going to see a lot of artificial intelligence in terms of AI in the platform of virtual medicine, where you won't even need to initially talk to someone in person. That you can actually just uh, declare your symptoms and what's going on, and a chatbot or something like that will process a lot of these before it filters this, and the actual doctors or nurses come into play. So I see that happening. I see a lot of advances happening in prescription filling and drug usage, drug as in the medical drugs, uh, usage by our patients, pharmacies. That's a big area where we're going to see this. Uh, we're going to also patients who leave the hospitals. How do we keep them out of the hospitals? So for a lot of chronic conditions, as pneumonia, heart failure, joint replacements, we are going to have all these virtual platforms where patients will interact before patients will interact with the healthcare providers and get 90% of the things done there, rather than coming back to the hospital or use the emergency room for non-acute conditions that they don't need to come in the first place. So I see that happening a lot. There's a lot going on, and there will be a lot happening.
Yeah, these past number of months have been incredibly challenging, and we've seen a lot of media about mental health. Do you believe that there has been enough emphasis placed on mental health, and is Miami-Dade County assisting those in need?
So I can tell you about. I mean, I know that Miami-Dade County has many announcements. In terms of the resources available for the community. I don't know how much the community utilizes that. Internally, the University of Miami Health System has been has been at the forefront in terms of leading this charge. So right from the time when the pandemic began, we appreciated that this is going to be a long haul. This is not a short-term phenomenon, and we have dedicated mental health uh, programs for our employees who can reach anytime through a hotline uh, to talk to a mental health expert. One thing I should mention is that our mental health physicians and nurses now provide 100% of their care through televisits. So that's an area that is completely pivoted from in-person to televisits. Almost everything is a televisit or a virtual visit on the mental health side. I think it's something that no one should ignore, uh, and it impacts everyone from the level of a janitor to the level of a resident or a fellow to a healthcare provider who's facing her or his mortality, or a frontline worker every day when they go to COVID, to the executive leadership with all the responsibilities in place. A lot of us are used to travel. That has not happened. We are confined into one area of work. There's so many challenges that the whole life, the way we knew it, has changed uh, in a matter of weeks to months, and it's a challenging task for anyone, even the strongest, to adapt to that. So you're not weak if you think that you're impacted by mental health issues, but I think it's okay to have these issues, but it's not okay to hide or run away from these issues. I think one should absolutely seek help, and this will all be temporary.
Dr. Parekh, testing for the coronavirus has been very challenging. How is UHealth handling the process?
Again, great question. The one silver lining to the pandemic, believe it or not, is if you look at the flu season in the Southern Hemisphere, it has been the best ever, best in terms of not having a flu season in decades. Because all the precautions that you're taking for COVID-19, they all apply to the influenza virus as well. So I just hope that we replicate that here. And I think don't let our not let to our guard down. Get the flu vaccine. I think it's critical to get the flu vaccine. All of us should get it, but definitely the people who are at extremes of age or immunocompromised underlying conditions, chronic conditions, for sure. But all of us should get the flu vaccine. And if you get the flu vaccine, and if you practice the safe practices in terms of hand hygiene, wearing a mask, I'm very enthusiastic and optimistic that this will not be bad for us.
When COVID-19 first presented itself in the United States, I think there was many people who had said this will be over shortly, we'll be back to business come the fall, and here we are in September of 2020, and that still isn't the case. We're seeing different phases of opening all over the nation, and we still don't have a vaccine. And even when the vaccine is ready, it will still take a while to distribute that to everyone in need. And so the past number of months have been incredibly challenging. What have they taught you particularly about resilience?
Uh, what it has taught me is you can't predict, but you can prepare. So it's been obviously proved that it is foolish to predict then, it is foolish to predict now. It's not in our control. But what is in our control is to be prepared, and that's what we are doing.
Well, thank you again. That was Dr. Dipen Parekh, the Chief Operating Officer of the University of Miami Health Systems. My name is Abby Malone, and you've been watching Invest Insights. Thanks for tuning in.
Hey everyone, don't forget to like this video and subscribe to our channel so that you can stay up to date on the latest business trends from our knowledgeable experts. Be sure to check out the description below for more information on the segment you just watched. Thanks for tuning in.